Hi, I'm Gwen Tombergs with LivWell Seniors, and thanks for coming today and being with us because we are going to talk about the moving confidently into your next chapter, but most of all, being proactive, knowing what decisions and options are out there for seniors, senior living, senior services. So, thanks again, and let's go. So, most people don't know where to begin. It's overwhelming, especially if you happen to be in a crisis. So, we want to say, what's the process? Where should I be looking? And is there help out there to assist us? And which, of course, LivWell Seniors is a free service that can help seniors and their families with senior services and knowing senior communities that are available. Why are people not being proactive? Let's talk through maybe what you're even thinking yourself. Is it so far off that you think I don't even need to worry about it right now? Or is it that my family's going to take care of me? I know your family loves you. They want to be there for you, but your family also probably has a family. They have kids. They might not even live locally. So, what else are you thinking? Is it that I just don't want to think about it? It's not something that I have to deal with right now. What about other options? Is it too expensive? Are you thinking that there's no way I can afford even looking at senior living or services out there that might help me in the future? You would think that maybe Medicare will pay for it or Medicaid later on. They're not an option. We'll visit that later. And then, of course, you just don't know about how to plan or the understanding of why to plan, which is why we're talking today so that you can know all your options and make sure that you are proactive in your decisions. So let's talk about where you are in the process. Are you being proactive? You're here today listening to this, so you're proactive already, even if you don't know you are. So the good news is you want to know more information than you have and arm yourself with options that could be decisions in your future. Are you reactive? And this is, 80 to 90% of the calls that we get at LivWell is reactive or crisis. You're in the hospital or your parents are in the hospital. Guess what? They're going to go to rehab, and then the doctor says you can't go home. They shouldn't go home. They're not safe going home. And then, of course, in a crisis, they are getting out of rehab and they have 48 hours to say, hey, you can't go home. What are you going to do? Which is why you would call LivWell Seniors to know what your options are so we can help you along the way. So, what are the emotional and financial risks, especially to your family? Everybody thinks that their family's going to help jump in, and your family might be jumping in right now, taking care of you. So, in other words, they could be your assisted living. And, so are they missing work? Are they having to run and go get your medicines, maybe pick up food? Are they bringing food over to you? Can you cook anymore? Do you want to cook anymore? Maybe it's hard to get around the house. The family's taking you, someone's taking you to the doctor all the time. And, what if you actually had a debilitating disease and your spouse is having to be the caregiver for you 100% of the time? Let's talk about how you pay for senior living and senior options. Um, Most of it's private pay. When we talk to you at LivWell Seniors and we talk about lifestyle, medical needs, we do want to talk about your finances because it is private pay for everywhere you go, unless, of course, you could be on Medicaid in the future, which would mean Medicaid pending. A lot of times people do think that Medicare will pay for senior living. They don't. It is private pay. We talk about your monthly income, any assets, how long your money's going to last. If you don't have to worry about it, great. But if you think that you might outlive your money, we want to have an honest conversation with you. The Medicaid, the elderly waiver, is out there. It depends if you're in Iowa or Illinois. We cover the whole Quad Cities. And so we want to, again, have that conversation about should you need Medicaid in the future. But most importantly, do you have long-term care insurance? And if you do, when was the last time you looked at the policy? A lot of people try to stay home and not use their policies. And I say, why did you buy it? Why did you buy it if you're not going to use it when you need to use it? So your long-term care policy, some of these policies are amazing. They pay for years. Some of them have lifetime guarantees. And you could be living in a senior community for free literally. Now, your long-term care insurance only covers assisted living, memory care, and nursing home. They do not do independent living. So you do have to go somewhere that needs assistance. But again, you just need to pull your policy out and see what it'll cover. And then, are you a veteran or a spouse of a veteran? There are services out there called VA aid and attendance. Then we can talk about that later too. But there is money out there should you need assisted living, memory care, or nursing home. And we want to make sure that you're available to know those services. So let's jump into VA aid and attendance. Now there's stipulations. I tell everybody just go to va.gov if you want to see all of the stipulations that you need to meet to get this money. In a nutshell, you have to have your DD-214. So if you're a veteran or a spouse of a veteran or a family member, dig that DD-214 out showing an honorary discharge, because you do have to have been enlisted, not necessarily in the war, but enlisted one day of an active war. So again, all of those details are at va.gov. But even if you're the spouse of a veteran, as long as you were married 1 year or longer, you could qualify for those benefits too. So that could be anywhere from $1,400 to $2,400 a month, which is substantial when you're paying for assisted living. So definitely look into VA benefits if you're a veteran or a spouse of a veteran. All right. Here's one of my favorite subjects, long-term care insurance. Again, if you are needing assistance, or if your neighbors or your kids are your assisted living and you have long-term care insurance, then it's time to use it. You definitely want to use the money that you've paid years and years into and use that for your care. That's why you bought it. But, you do need to know what your long-term care insurance policy has as far as benefits. So one of the things about your policy is reviewing it about your activities of daily living. This is usually what it takes to get your policy started. So in your policy, you're going to find out whether or not you have so many activities of daily living you need help with. That could be bathing, dressing, transporting, transferring, like from a bed to a wheelchair to the toilet. It could be going down to dinner. Some of the really good policies actually have food in it. Most of them don't have medication management, because that's just what everybody needs once you go into assisted living, is help taking your medicines correctly. But you want to find out how much money will you be getting monthly? How long will that money last? I'll give you an example of my own. I bought long-term care insurance, and I can get $5,000 a month up to $250,000. So a little over 4 years, that policy will pay for my assisted living in the future. But knowing that and using it, most people don't use their long-term care insurance and get all of that money back. My mother-in-law had a policy that assisted living wasn't even covered because it was a nursing home policy. So when we went and applied for the assisted living, she only got 60% of her monthly money. And guess what? She died a year and a half later. So even though she spent all those thousands of dollars getting that money into her long-term care insurance policy, she never got that out of it. So I encourage you, if you have it, use it when you need it. So let's talk a little bit about all of the legal documents that you need. I'm not an attorney. We do refer to attorneys if you do need something, but do you have a living will? Do you have your power of attorney? Do you have your power of health? Now that could be two different people, by the way. Some people have their son be their power of attorney for the finances, and maybe the daughter for the power of health for their health. Again, it can be two different people. It doesn't even have to be family members if you choose so. Then, do you have a will? And, I know these seem like really simple things, but if you don't have any of these documents that I just went over, run to your attorney. Don't walk. If you need an attorney's name, call our office, because it will make life so much easier for those who will take care of your assets after your passing, to have all of these documents in place. So one last thing, digital accounts. Do you have Facebook? Do you have, does somebody know the login to get into your computer, your phone, your Facebook? If you don't have somebody knowing all of these codes, guess what? Your digital life will live on and on. So please make sure you write those down and give that to somebody who is your POA or POH. So let's talk about some of the other options, especially if you want to stay in your home. There are home care agencies, obviously, that can come in and give you some assistance. Some of them are light assistance, like, for example, help with bathing, help with cooking, maybe your medicines, depending on the care level that you need. But those are home care agencies that can come in and do some light duty things around your house. It might just help you stay in your home longer and not have a really high level of care needs. And then, of course, there are the medical skilled nursing services that can come into your home. So let's say you need help with shots, and let's say you need help with monitoring injections, or you need physical therapy. These are going to be medical professionals. They're going to be a higher level. When you have home care, you can say it's $35 to $50 an hour just for basic care needs. When you start getting into medical needs, you're going to be $50 an hour or more. Every agency is different. We do have some providers that we have and we can recommend to you. But when you do call for home health care, what I recommend is that you know exactly what you want them to do. So if you want to call around and get a couple of prices or agency feedback, that you can say to each one of them, I need this done in the house, and can you tell me if you can provide it, what the cost is, and get more information. So why do you think about moving? This is very interesting because nobody wants to move. Moving stinks. You know, you've been in your house 30, 40, 50 years. The last thing you want to do is think about moving, packing up, and going somewhere else. However, is your bedroom upstairs? Is your laundry down the basement? It's not a matter of if you're going to fall, it's when you're going to fall. So if you're proactive and you're looking around and trying to decide early on, hey, maybe I should start thinking about getting out of my house. It's not safe here anymore. Or maybe you've already been falling. And it's like, I need to think twice about this. Or, like I mentioned before, is your family or your neighbors assisting you more and more? Are you paying for everything around your house? All you do is maybe go grocery shopping if you drive at all. So these are things to start thinking about, that maybe it's not time to stay home. Here are some more interesting things to think about. Why should you move? Have you lost your spouse? Maybe you just don't want to be home alone anymore. Maybe your spouse did all the driving and you really didn't drive a lot. So it's just easier to go to a senior community that has transportation available to you. Maybe you don't want to take care of the house anymore. Maybe you don't want to pay for all those extras. Maybe you're just lonely. Maybe you're more isolated by being home alone and it's just too hard to get out these days. Maybe you don't drive. Maybe you don't cook. I know I don't like to cook, so God help the day I need to be cooking on my own, because I will be going to a senior community first just to have my meals made for me. And then, of course, socialization. You know, it's it's filling your soul being around people, especially around people your own age that have the same things happening to them, and you want to, be with people and just walk out your door and be with them instead of having to drive across town or call somebody to come over and visit you. All of these reasons are really good reasons to think about moving. All right, everybody, I'm going to say one really important thing is change your wording. You're not going to the home. You're not going to a nursing home. You're going to a retirement community, a senior living community. So I tell everyone who might be talking to their spouse or their family, or the family talking to the senior, that you are going to a retirement community, and it is a beautiful, fun place to live. So let's talk about senior living communities. You have independent living, assisted living memory care, and of course, nursing home. There is also assisted living, nursing home, memory care, but we'll talk about that later. So when we discuss what level you're looking at, we discuss your lifestyle. Do you have any medical needs? Maybe you don't. Maybe you just don't want to be in a house anymore and care for a house, and you just want to go to independent living. And then, of course, the finances, because we want to be open and honest about, do you have a concern about money lasting so long? And if you do, let's talk about it honestly so that you are comfortable knowing the price points of all of the communities. So we are blessed to have a lot of senior community options in the Iowa and Illinois Quad Cities. One of them is fabulous for everybody. And that's why we tour and make sure that it's a good fit for you and your family too. So they all have a lot of things in common. They will all have some kind of a meal program. They'll all have some kind of transportation, exercise, chair exercises, exercise room. They're all going to do housekeeping. They're all going to have a safety pendant, some kind of activity calendar that changes monthly, but it's just a fun, carefree way to live. I don't care if you need assisted living, independent living, whatever it is, they care for you, and they have activities and fun things to do. They all have a second person fee. So if you are going in with a spouse or a relative, there is a second person fee. Sometimes there's a care, it's rent with care on top, but the second person might not need any care. So again, these are the price points that we can discuss when we talk and meet with you. So let's talk about independent living. Independent living is basically being in a senior community with amenities. The price points can vary between $1,800 and $5,000 or more a month. It depends on the size of your apartment and the amenities in the community. It depends on how many meals you get, the transportation provided. Some of them have full kitchens, some of them have kitchenettes. It just depends again on that community. Some of them have a washer and dryer right in the unit. Some of them, they're a community common area for your laundry right down the hall on the same level. And then again, that list that I went over with all of the amenities that every community has, that's why we tour, to make sure that you're seeing what's going to be a good fit for you. So independent living also just has senior apartments with little or no amenities provided. Most of them are market rate apartments, and you will be based on what your income is. Now, we do have a division called LivWell Cares, and the team over there will walk you through what your options are if you just want to go into senior living without any amenities, and they can help you. So let's talk about assisted living. Assisted living is going to have some of those activities of daily living cares, the bathing, dressing, maybe transporting, maybe transferring, getting you down to the dining room. Maybe you had a fall and you need it for a little while, but you don't need it all the time. So assisted living is rent plus care. So when you go into a senior community, into assisted living, again, the size of the apartment is going to dictate just the monthly rent, and then the care is on top. So if you need a little bit of care or a lot of care, that care plan can go up and down. Some of the communities are a la carte. Some of them will have a care level. And again, that's what we look at when we tour with you. They, again, are going to have it's all a private apartment. You have your own apartment. You have all the meals, the weekly housekeeping. You have weekly laundry. They'll do your laundry for you if it's in your apartment or not in your apartment. The staff is available 24/7. And that's the best part about assisted living. Is just if you need anything, if you just push your button, somebody's going to call, usually come and see you within 3 to 5 minutes is the norm. And again, we can ask that when we go touring too. They'll help you with your medication. They will do the refills for you. And some of the communities, like I said, they're a great fit for different people. Some of the communities are small, 28 apartments, and then they can go up to 135 apartments. So again, it depends on your lifestyle and what you're comfortable with. So in assisted living, the range could be anywhere from $45,000 to $5,000 a month up to $7,000 or $8,000 a month, sometimes even a little bit more. Remember, I said they always have that second person fee if it's a couple going into an apartment. So that price range you can see can be substantial, and we want to make sure that it fits in your budget. So let's talk a little bit about memory care. This is assisted living memory care. It is not in a nursing home. There is nursing home memory care, and it's just a whole different ball game, which you don't want to go there unless you ever have to, but sometimes memory care is needed. If somebody is a flight risk, that's usually one of the top reasons that you might need to go into memory care. It is a secured unit. You have all the wonderful things that you do in assisted living. You have your meals, 3 meals provided. You have housekeeping, laundry, activities, outings. Many of the communities bring the residents from memory care out to the assisted living and integrate in all the fun activities. family comes and goes as much as they want. So do the residents in memory care or assisted living. So it really is more of a structured, dementia friendly. Staff is they're very trained on memory care, dementia, and how to redirect someone. But again, if it's needed, it's there for you. So the last example is called continuing care community. It's a community, and there's only 4 in the Quad Cities, that have all 4 levels of care. It has independent, assisted, memory care, and the nursing home all under one roof. So that is great if you maybe have one spouse who's in independent living and another spouse might be in memory care or even the nursing home. You can still be under the same roof. Most of the communities will have a financial form that you do need to fill out so that they make sure that you're not needing to leave or be on Medicaid in the near future. It's an age in place option with all levels, like I said, under one roof, which is a really big benefit, especially if a spouse is in a different place than you are for care and needs a higher level of care. And again, there's only 4 in the Quad Cities, and we can make sure that if that's going to be a good fit for you, that we can go tour them. All right, let's talk about skilled care. Skilled nursing is the same thing as rehabilitation. So you go to the hospital, the doctor says, hey, you really need some rehabilitation. Let's go ahead and go to skilled care. Skilled care for the norm is going to be up to 20 days. Medicare will pay for it. You have to be progressing. They have weekly care team meetings to make sure you're progressing. If you need longer than 20 days, you do have to appeal it. But it's get in, get out. You want to get in, you want to rehab, you want to get out. It's done in a nursing home because you have to have 24/7 nurses on staff. So rehab, skilled care is done in a nursing home, and it's a nursing home. So like I tell everyone, get in there, get rehabbed, get out. Let's go somewhere that is not a nursing home. You never want a nursing home unless you absolutely have to have one. But again, even when you're in rehab, you still have the meals, the laundry, housekeeping, activities. So we just want to make sure you rehab and get out as fast as you can. So a nursing home, sometimes it's a necessary, part of life to be in a nursing home as a resident. If you do have that long-term care, a lot of that can be paid for by your long-term care insurance, but otherwise it's private pay if you are needing a nursing home and you're not on Medicaid. It could be $10 to $12,000 a month or more. So why do you go into a nursing home? The 3 most important reasons you go into a nursing home is that you're bedbound, you have uncontrollable incontinence, or you're a 2-person transfer. The 2-person transfer is usually why somebody needs a nursing home. It's a state law that, if you takes 2 people to dress you, bathe you, transport you over 50% of the time, that means you're a nursing home candidate. You still can have intensive care in there, the physical therapy. Most of the time you can have a private room. Sometimes there is a shared room, especially if you're on Medicaid. And it definitely is, like I said, a necessity for some people when they need that higher level of care. And again, that memory care in a nursing home is a secured unit in a separate area of the nursing home. So one of the things that keep in mind if you end up going to a nursing home or you need one in the future for somebody in your life, that a lot of times it's really hard to find a Medicaid bed. So that's where our cares team can come in and help you. But if you're getting down to your last couple of years of money and you think that nursing home might be in your future, it's easier to get in doing private pay than it is on Medicaid or Medicaid pending. So again, let our care team help you with that. Don't try doing it alone. That's why we have experts that can help you with that. So there is another option out there called respite care. And respite is a furnished apartment in assisted living that you can use anywhere from 14 to 30 days. It's furnished. All you do is bring your clothes and your medicines, but it's a way for you to have immediate placement without having that commitment of going somewhere long term, Or we say, try it before you buy it. Go in, let's say you have a wedding and mom or dad can't make the trip, but they can't be, they're living with you. You need them to go somewhere for a while. Like I said, it's a furnished apartment. Not all communities have it. And so it's based on availability. So again, we can help you. LivWell Seniors can help call around, make sure that there's a respite apartment available. And then sometimes it's a way that somebody who really should be in assisted living can go and try it and really like it, see the care they need, the 3 meals, the laundry, the activities, the fun, and then they end up staying. So it's just a great option out there if it's available. So LivWell Seniors also has some secondary options for senior services. We can help with downsizing, relocation, estate planning. We do work with some providers out there that we can recommend, financial planning, education support organizations. We never turn anyone away based on your income. That's why we have LivWell Seniors and LivWell Cares. So anyone can call us and get free services for any of these options out there that we have and we have access to. And we also have other senior solutions. Never be afraid to call us, because if we don't have the answer, we're going to find one for you. All right, so remember, you don't have to do this alone. LivWell Seniors and LivWell Cares, we are a free service that we can help with senior solutions to anything that you have questions about or need. And most of all, we can go with you and find the right senior living community that's a good fit for you or your family. And again, we are a free service. You don't have to do this alone. Just contact LivWell Seniors and we can help.